We finally have an answer. How often should you be having sex? I'm Dr. Rena Malik, urologist and pelvic surgeon, and I get asked this question all the time. And until recently, I didn't have an answer. But it turns out, based on a new study, I might just have one. Prior studies have shown, not surprisingly, that having sex boosts your mood and even helps you have a positive feeling about your meaning in life, and even the day after having sex. And that people who have more sex tend to have less anxiety and less depression, and even better health outcomes compared to people who tend to have less sex. But how much sex is enough sex? So a study was published in the Journal of Sexual Medicine, and it looked at data from over 15,000 adults in the United States. The researchers wanted to understand the trends in sexual activity over time and how sexual frequency, or the amount of times you have sex, might impact your mortality or death. Now, the researchers used data from the National Health and Nutrition Examination Survey, or NHANES, and this is a nationally representative survey that collects health information from Americans. And starting in 2005, NHANES started asking participants about their sexual activity in the past 12 months. Participants then reported how often they had vaginal or anal sex, with options ranging from never to 365 times or more. And the researchers then followed these participants for about 6 years on average, and they tracked who passed away and what they died from. This then allowed them to see if there was any link between sexual frequency, or how often someone was sexually active, and their risk of dying from any cause, as well as specific causes like heart disease and cancer. Now, here's what they found. Over that 11-year period from 2005 to 2016, the percentage of adults who were between 20 and 59 years old reported having sex at least monthly was 72%, and at least weekly was 36%. But here's the really interesting part. The study found that participants who reported having sex 52 or more times per year, so at least weekly, had a significantly lower risk of dying from any cause compared to those who had sex less than once a year. Specifically, they had a 49% lower risk of dying from anything and 69% lower risk of dying from cancer. Now, of course, less than one and more than once a week is a huge difference. But when you look at the people who had sex anywhere from 2 times a year to 51 times a year, they saw that those people also had a 36% lower risk of dying. Now I'm going to take it a step further. Another study looked at the same database, and they recently published their results in 2024. And this was researchers from Walden University who published in the Journal of Psychosexual Health. And they looked at this link between the frequency of sex, depression, as well as death or all-cause mortality in that same database. So they had over 14,500 adults. They looked at their self-reported sexual activity, again, over the past 12 months, as well as their depression levels, which they measured based on a questionnaire called the Patient Health Questionnaire 9. They also tracked death rates over the following years to see, again, how does this relate to death? And they divided it up by gender. They also looked at depression and how that impacted the risk of dying and how they worked together. So ultimately what they found was that women with lower sexual frequency, defined as less than once per week, had a 70% higher risk of dying during the study period compared to those with higher sexual activity, meaning once a week or more. Now that's a pretty staggering difference, and they even accounted for factors like age, obesity, and other health conditions. But here's where it gets even more interesting. When they looked at the combined effects of having depression and sex frequency, the results were even more dramatic. Now, people who had depression and low sexual activity had nearly a 200% higher risk of dying compared to those with depression alone. In other words, having sex less often seemed to amplify the negative effect of depression on overall health. Now, on the flip side, for those who had depression but still had healthy sex life with having sex once a week or more, their risk was actually not significantly different from those without depression. And so it might be that sex is actually protective if you have other mental health issues like depression. What's going on here? Now, we can't say for sure that sex itself is causing people to live longer. And the study obviously had some limitations, like people had to actually remember how many times they had sex in the last year and write that down. However, it's possible that those who are more sexually active also tend to be healthier in other ways. The researchers also thought that there might be some key mechanisms at play. First of all, sexual activity has been shown to have cardiovascular benefits like reducing heart rate variability and increasing blood flow. It also causes the release of feel-good hormones like endorphins, and it leads to the emotional benefits of intimacy with your partner and overall a feeling of connection, which we know is so important for longevity. So when we add depression into the mix, we also know that depression is often correlated with people having lower sexual desire, and a lot of the medications that you use for depression can further worsen libido and even affect sexual performance. So when depression and low sexual frequency are combined based on this data, it's sort of a compounding negative effect. Now, I want to be clear. This is not to suggest that if you're having less sex, you should force yourself to have more, but it's to say that sex matters. Intimacy matters. Connection matters. If you are fortunate enough to be in a relationship, prioritize your sexual health and connection with your partner, because it's not always going to be spontaneous and easy, but clearly it's worth doing, not only to enhance your quality of life or enjoyment, but for your health and longevity. If you guys enjoyed this video, make sure to check out my newsletter where I send out a weekly newsletter, or almost weekly, that covers some interesting piece of research. It also answers questions that our subscribers can submit in the newsletter itself, and allows people to learn about maybe things they missed on the YouTube or the podcast and what's going on with me every week. So if you would like to get that in your inbox, make sure to check it out. It's called Urology by Dr. Malik, and I look forward to seeing you there. And as always, remember to take care of yourself because you're worth it.